another remedy, next remedy in Phatak Materia Medica, that is Absinthium. Absinthium, according to Phatak, it is a powerful neurotic remedy. It mainly acts on brain, nerves and motor centers. It is not a slow remedy like a gelsemium, conium. It is a violent, sudden, violent, stormy nervous system remedy. Suddenness is marked, violence is marked, and stormy nervous system is marked, similar to belladonna. Phatak highlights absinthium especially for convulsion, epileptiform seizure, tremors, hallucination. The main core or essence of the absinthium is sudden loss of control over nervous system, means trembling before attacks, sudden convulsions, complete loss of consciousness and violent recovery. Attacks comes fast and recovers fast. There is no gradual warning of attack. The attack comes like electrical shock and uh, uh, goes away. Absinthium does not warn, it directly strikes. Mental and emotional totality of absinthium is given by Dr. Phatak is sudden vertigo, tendency to fall backward, forgetfulness before and after convulsions, wants nothing to do with anybody, brutal insanity and kleptomania. In OPD, may patient says or may patient present with doctor after the attack he behaves like a different person, means epileptic person may behave like a different person. This is a post-ictal convulsion with mental brutality. Physical general we can see is tremor is the keynote of nervous system of absinthium. Tremor of trunk, convulsion preceded by trembling, tremor of heart means palpitation. Seizure patterns or epileptiform patterns of absinthium is quite different. It bites tongue, foams of the mouth, grimaces, attacks occurs in rapid succession. This helps the differentiation from slow periodic epileptiform medicines. And tremors accompanying the convulsions. The children, especially it's mainly used in children's and sleep. So nervous excitement of children, sleepiness, especially useful in children's, especially absinthium I use in febrile convulsion or child who have previous history of febrile convulsion and he parents needs acute remedy when they think that the convulsion is coming. In allopathic frusium tablet per rectal given in pediatric, but I usually give them 2 bottles of belladonna 30 and absinthium 30 as soon as they feel that the patient has fever and may proceed into the convulsion. Absinthium 30 and belladonna 30 alternately depends upon the severity, every 15 minutes, every 30 minutes till the patient gets settled, and then afterwards we can start with constitutional remedy. Peculiar symptoms and keynotes of particular symptoms and keynotes of absinthium is sudden giddiness, feels as if losing balance to the backward. Backward falling is a main symptoms in most of the vertigo and convulsive patients. Spasmodic facial twitching, grimaces, foolish and vacant expression, discharges after headache in ear, tremulous action of heartbeats heard in the back, means tremors of the heart is tremulous action of the heart. Urine has very strong cell, deep yellow color. Convulsive patients who urinates in close and having bad smell is also one of the clinical indication that parents says that the child after convulsions or he has a bad smell of urine. Female, premature menopause, nervous disturbances during climacteric. So, in day-to-day's era, what type of patient you can think of absinthium is epilepsy, especially sudden onset epilepsy. Second is febrile convulsion in children. Third is chorea. Fourth is acute delirium with hallucination, may also alcoholic tremors, withdrawal or toxin related seizures. In these patients, may MRI may normal or but ECG may abnormal. This is a functional neurological disturbance, not a structural damage like a febrile convulsions or in epilepsy sudden onset of type. So we can have many of remedies that have convulsions or epilepsy. So we need to compare with these remedies. First remedy, of course, come in mind is cicuta virosa. Both have common convulsion of autonomous position, but cicuta has a more rigidity and fixed stares. His hands, legs rigid, and his eyes are fixing stare. While abstinentum is trembling, convulsion, and confusion. Abstinentum characterized by trembling. So more rigidity, more cicuta, more trembling, abstinentum is indicated. And both in clinical practice may follow each one each. In acute condition, you may prescribe abstinentum or you have to distinguish in between. Though both remedies are very closely related, often confused. So clinical understanding has differentiating points. For the cicuta has extreme rigidity, obsessional position, fixed staring eyes. Abstinentum has trembling before convulsion, more mental confusion and hallucination, less rigidity, more nervous instability. So rigidity dominates the cicuta, tremors and confusion dominates the abstinentum. Then another remedy we can think of abstinentum versus sina. Both have convulsion in children. Sina has irritable and worm related. Abstinentum is hallucination and brutality. Another remedy is abstinentum we can compare with hydrocyanic acid, which have sudden collapse. Both have common symptoms of sudden collapse. So in hydrocyanic acid, instant collapse and death like situation, patient collapses and death like situation comes, while in abstinentum, recurrent violent seizures. These are the differentiating points. Another remedy we can think of is Artemisia vulgaris. Both have common epileptiform seizures. Artemisia is indicated in more chronic epilepsy. Abstinentum is acute, stormy, and violent attack. So in this remedy, Phatak gives us related remedies. In that, above 4 remedies are mentioned, related remedies to the abstinentum is Artemisia vulgaris, cicuta virosa, sina, and hydrocyanic acid. So when we need to think abstinentum is the basic question. In highlights or in few words or 4 to 5 words that reminds us abstinentum in day-to-day practice is sudden convulsion, second trembling before attack, tongue biting and frothing, rapid succession of attack, post attack forgetfulness or brutality or indifferent mental state. These are the 4 to 5 symptoms we need to understand. When tremor becomes seizure, abstinentum is clearly indicated. Before seizure, patient has tremor, then abstinentum is clearly indicated. So each and every seizure, we don't need to prescribe abstinentum. No tremor, no violence, abstinentum is not indicated. Clear emotional causation, no abstinentum is indicated. So abstinentum is not a chronic epilepsy remedy. It is acute violent nervous trauma with tremors. So potencies that I commonly use is 30 in acute stages, rarely 200 with recurrent episodes. So this is the about the abstinentum. If I want to summarize the abstinentum in few or 1 or 2 words: suddenness, violence, nervousness, and trembling. Abstinentum teaches us when the nervous system loses control suddenly and observes deeply. Not every seizure is same, and not every epilepsy is abstinentum. Thank you very much for patience listening. See you in next session. Thanks.